The immune system can do both, destroy and heal, and it is commonly forced to do both simultaneously. The vast majority of time this occurs without us even noticing. Anyone who slipped and fell on the ice and hurt their back would expect to be sore for a while. Most people who injure themselves mildly go on to heal on their own and do not seek any sort of medical intervention. For most of us, a little head cold will not encourage us to run to the doctors for medicine. We expect our immune system to work. We expect it to quickly resolve all of the health problems that we confront. We do not expect to experience any of the symptoms of inflammation for a prolonged period of time. We understand cause and effect. We don't want to overreact. But if we are injured or become ill, we expect to get better in short order. It is only when inflammation becomes perpetual. It is only when symptoms do not resolve or are unexplained that we think there may be a problem. If your back started hurting and you knew you had not fallen or strained it, you may wish to seek out professional help in order to determine the reason why. It could, in some very rare cases, be a kidney problem. If one becomes sick with a simple cold but continues to experience symptoms for too long, a trip to the doctor is warranted. And certainly, chronic back pain or chronic sinus allergies and asthma are medical conditions that require an investigation by a medical professional. Chronic inflammatory conditions vary widely. They can affect any tissue or organ in the body. They can come and go with little or no warning, and they can be extremely debilitating. A malfunctioning immune system can kill a patient. They can be merely annoying. A small patch of itchy skin is a good example of a chronic inflammatory pattern. They usually associate with some or all signs of inflammation, and these include pain, swelling, contracture of tissues, irritation, in some cases redness and heat. When inflammation influences an area, the body reacts by encouraging the tissues in the area to contract and swell. This brings blood to the area and stabilizes the region. Inflammation encourages pain messages to be initiated and propagated. This tells the patient to not use the area until it's safe. Symptoms are a good thing. They are helpful in most cases. But when inflammation operates properly, the immune system gets fixed. Inflammation as a process can also be described as healing. For most patients, it is not the severity of the infection or injury, but the capacity of the body to heal from it that is the most salient feature. For some, the relatively minor sort of injury that occurs as a result of sitting with imperfect posture can cause more pain and suffering than another patient who was injured as a result of severe trauma, like from a car accident. In the first case scenario, the patient continues to experience symptoms of inflammation chronically. They are in agony and seek intervention. All imaging tests may be normal. There was no apparent injury, yet they suffer chronically, even getting worse over time. In the second case scenario, the patient who was very badly injured, but then goes on to improve and heal completely, doesn't need any doctors or medicine. They were badly hurt, but are getting better every day and expect a complete recovery. So inflammation is both friend and foe. We wouldn't survive a day without it, but if it is activated by mistake, it makes our life miserable. Why the long introduction? Well, it may be helpful in understanding the next segment of my little presentation. What a patient might be able to do for themselves in order to determine if they are suffering from a chronic inflammatory pattern that has the capacity for being put into remission as a result of a lifestyle intervention. Is it possible for the patient to fix themselves? Just like the little kid who cannot eat a peanut without risking his life, some patients are reacting to a food or an ingredient. They just don't know it. As a practitioner of alternative medicine, I commonly see patients who are in a vulnerable position. Often they are frightened. Maybe they have been experiencing symptoms and, upon consulting with a physician, learn that they are suffering from a disease. The physician suggests that the patient needs a strong medication in order to prevent the disease from progressing. They may recommend surgery or something the patient finds frightening. The patient may then seek the advice of a practitioner of alternative medicine in the hopes that there is another way to treat their condition. These patients are in a vulnerable position. They are ready and willing to hear any advice that allows them to discount the advice of their doctor. There may be a mistrust of the modern medical system and all of its interventions. There may be a fear of medicines and surgeries. Reacting with fear does not predispose most folks towards clear thinking. These patients are commonly taken advantage of. They can be sold relatively easily on unproven therapies. They may be convinced to undergo complicated and expensive testing for which there is no conventional consensus on accuracy. They may be sold dangerous supplements that are untested and prescribed on the thinnest of justification, often solely on the word of their trusted practitioner. Understand this: supplements are not tested. They are exempt from any and all testing. Only in the face of widespread harm are any supplements even looked at. Those that sell them, to those that take them, do so at their own risk, with no means of evaluating them other than that which comes from their manufacturer. In the rare cases where they do get tested by an impartial outside agency, they are commonly found to not contain what is claimed, and when are tested against placebo in patients, are found to contain harm. Common vitamins, taken in common dosages, when they are finally tested, often are found to cause harm. I do not recommend them. My approach is very different, and my approach does not associate with risks or costs. For some patients in this large category, an intervention strategy that involves a lifestyle adjustment can be the most effective. To be clear, there is no money to be made as a result of this attempt. It is extremely safe to try. It may be a hassle for the patient. Some are unwilling to consider it. Others find it too difficult to maintain. But for the majority of patients, this approach represents an attempt to find out why. And they're happy to give it a try. Why is the immune system malfunctioning? Is something stimulating it in the wrong direction? Can that element be identified, and does eliminating it allow the immune system to settle, to recalibrate itself and improve its function? This approach is not always successful. Sometimes I am barking up the wrong tree. But considering the potential for improvement and other options in front of us, I would consider turning over every rock in order to find a solution. And while some do not, most of my patients agree. In these cases of chronic inflammatory patterns with an uncleared etiology, I suggest a short experiment.